about the health industry is a completely new thing. We might all think that digitalization already arrived, especially in the healthcare industry. We hear a lot about technology being integrated in the healthcare industry. However, there's a lot missing, and nobody is talking about this. The healthcare industry is one of the biggest industries that is actually the least digital, and those technologies that are existing and that are available the least. So just think about you as a patient when you want to go to the doctor, or you kind of set up your appointment and go to the doctor. And how is usually the process going on? Does the doctor already have all the information about you, or do you every time and have to repeat yourself? Do you provide all the information that are necessary for your current health situation? If you think about the healthcare industry in general, it is such a system that is normal. However, there's also something else possible. For me, in my experience, I've been in the healthcare industry, in the digital part of the healthcare industry for over 14 years now. So is I use data such as the images of CT scans and create software, or help to create a software that analyzes those images to predict or to foresee diseases or illnesses early on. And I've been doing this for quite a couple years now, since 2000. My first ever project in this field was in 2007. So if I think back, it's like it's a really long time. That was my first trial as a student. And ever since, I've been just working in such as CT scans to predict diseases in the healthcare industry, in medicine. So, and those kind of technologies, for me, they are pretty novel since I work with them every day, and it's like a very high-end product or very high-end technology. That is there, it is existing, it is usable, and it brings a lot of value. You can predict diseases early on, and it has mostly even an accuracy level of like 95% and even more. So you can really predict, let's say, a heart attack just by analyzing the data. If you set up the correct technology and if you like integrate everything correctly. And it is possible. There are technologies who do this kind of support for doctors. However, there's one thing that is missing, and that is this kind of technology exists, but it's not being used most of the time. In many countries, in many places, it's just not being integrated in the daily workflow of doctors to support them in the diagnosis process. So, and nobody talks about this actually, because we have something that is already there, it's existing, and nobody's using it. So, with this question in mind, I started my journey 3 years ago. When I was like in my PhD program, I was thinking about, okay, we don't have technologies, awesome things, 3D simulations, and predicting any health conditions early on, so you can actually prevent more diseases, but it's not being used. So what does it bring if you have this technology, but you're not using it? It's like you have a car sitting outside your house, and you work or you have to go somewhere. It's like 5 miles away, but you're not using your car every time trying to use some other vehicles or some other system transportation, or you use a cab or anything else instead of using your car. So what's having that if you're not using it? And it's the same idea with the healthcare technologies. They're existing, many of them are existing, but they're rated in the healthcare system. You have examples or some scenarios or special places, not special, but some hospitals have been very innovative and been using this kind of technology, integrating them in their system. And if we're helping, trying to bring it in use in the daily use of the healthcare industry, but it's not the thing. So this needs that. Therefore, I am on a mission to a little bit more those kinds into the daily life of healthcare, of medicine, and help create an use system, an ecosystem where you actually can use those kind of technologies simply, easily through an app, just relying on the facilities who will have those technologies, because most of them won't. We create an app that gives you, as a patient, the control of your health record. This means you basically get an application where you sign up and store your health information at one place. And then you have also the control sharing this information with your doctor, the hospital, or other healthcare facilities, clinics, you want to. So you have the control of sharing it, how much you want to share of this kind of information. And on the other side, this app has an integrated prediction system that helps doctors, firstly, access all the information, and secondly, it does a pre-out of your health situation, so the doctor can see your health condition early on, so it can has like a summary or entire history of medications you took in the past history of your entire medical documentation, what surgeries you had, what illnesses you had, and the doctor can have this overall summary and can work a little bit faster and with more accuracy to actually finding out more about your health condition, and also as a next, also to the next evaluation of your health condition faster and better. So this is what we're creating right now, what I'm working now, and this will be launched pretty soon. And we have been working with the hospitals for an trial project. So once we finish this work and get our first results, we will be able to also show the benefit system. And once we have the first, we'll be able to use regular patients' health data to support the entire medical making with the information directly coming from the patient doctor. So if we just consider look on the entire healthcare industries globally, every country has their own standards. Every country has their own healthcare system, definitely. But the main important thing here is every country also has a different storing and using patients' data. So when I think about me as a patient, I have all my entire patient's history, the medical information stored at one place, and then I go to a doctor and share my information simply by clicking or using an app and giving permission through the app. That saves so much time, that reduces so many errors, because all the information is in the form of a digital storage, and once the information is already shared, there is no way I can forget anything to share with my doctor, or any sort of miscommunication. So the information can be stored and then shared with the doctor. So the doctor has access to the entire history, to the entire information, and can make a informed decision, which will help also the doctor process, because the certainty that they can access information that is already valid in a clinical or in a medical matter. So the main idea of this is like connecting patient at one place, at one source for the patients. And then once we have the information, we use an additional predictive method to help support in the decision-making process. That will just help to prevent a lot of diseases, errors that can happen just simply by providing the information, providing the data, and then using this to support the diagnosis process for the patient, to benefit patients. And it's in the process of building this entire system and working with hospitals, also for more partners in hospitals or clinics, where we can just integrate the system, this new patient's health record system, and help to provide a better quality of medical services for the patients, and also support the doctors in their entire workflow, because usually the doctors have really not much time in their entire day to really go through the entire history of the patients, and also help them to reduce errors that could just happen because an information is missing. And with the system, we will build up a new medical ecosystem that can be used globally. And you think about it as you can use it actually in every country. Let's say you travel to a new country and then you just go to a hospital or to a doctor, and then you can simply share your information. And this doctor has immediately access to all your information, plus gets also this support of this predictive decision making about the entire history. So the risk of getting a wrong medication or getting a wrong treatment is reduced by this simply, and it will also help to move forward faster in the entire medical care sector actually. So this is what I'm currently building on, and I will be sharing more about what I'm doing, how the progress is in the future. So, and yeah, I'm looking forward to also get a lot of feedback on what you think would be the biggest benefit if you would just simply have an app on your phone where you have stored all your entire medical history and you have the complete control over this information. So that information belongs to you, and you have the complete control over who you can share it with and how much you can share it with and what kind of information those people can see. And I would be very happy to hear about your feedback, what you think about this kind of technology and how that would really actually benefit you, and like the benefits, or maybe also the the negative aspects of it if you see anything questionable about it. Um, just comment just somewhere, and I will make sure to give and answer the questions. So for right now, that's it for me. If you got any questions about it, just send me a message or comment on this video. And yeah, we're wishing you a great day.